Hi, welcome back to Chapter 11 for Concepts Med-Surg on Cancer. This is part 3. Enjoy. Cytoprotective agents protect healthy cells from some side effects of certain chemotherapeutic drugs. For example, dexrazoxane, also called Zinacard, helps prevent cardiac damage associated with doxorubicin. Amifostine, also called ethiol, helps protect the kidneys from platinum-based chemotherapy. It also protects normal cells in parts of the body against damage from radiation treatments. Mesna, also called Mesnex, protects the bladder against chemotherapy drugs such as cyclophosphamide, also called Cytoxan. New treatments being researched. New therapies for cancer are constantly being researched. For example, hyperthermia has been used with radiation and chemotherapy. It has been beneficial in some types of cancer. However, it is typically used only in investigational studies. Biological response modifiers, such as interferons, are drugs used to stimulate the immune system. These drugs are used commonly for specific types of cancer. They have produced some beneficial results. They're also being used in many investigational studies. Visit cancer.gov for information on current clinical trials. Nursing process for the patient with cancer. Data collection. Thorough assessment of the patient with cancer will help the healthcare team build a plan of care relevant to the patient's needs. The nurse should monitor laboratory studies. Potential for bleeding exists when the platelet count is 50,000 cubic millimeters or less. 50,000 per cubic millimeter or less. Risk for spontaneous bleeding occurs when the count is less than 20,000 per cubic millimeter. Monitor the white blood cell count for risk of infection and the red blood cell count for anemia. Monitor the patient's weight. Note reports of nausea, changes in taste, vomiting, and diarrhea related to either the disease or treatment. Monitor the oral mucosa for lesions or inflammation. Also, watch for signs of dehydration. Nutrition notes. Assessing the need for nutritional support presents criteria for determining whether a patient needs nutritional support. Psychosocial issues related to cancer are as varied as the persons afflicted with the disease. Help the patient explore perceptions about quality of life. Culture and age affect cancer perceptions. Assess the patient's ability to cope. Discuss coping strategies that have been effective in the past. Determine what information the patient has received and understands about his or her disease and prognosis. Assess the roles of the patient and caregiver in the family. Be aware of whether the caregiver can be at home or whether he or she must be at work outside the home while also caring for the patient. Isolation can be either self-imposed or imposed by friends and family as issues surrounding terminal illness are confronted. It can be very distressing to see a loved one decline from cancer. Often people say they are afraid of saying or doing the wrong thing, so they just stay away. Listen for cues from patients expressing self-blame, anger, or depression. It is important to recognize signs of depression and suicidal tendencies. Nutrition notes. Assessing the need for nutritional support. The National Cancer Institute's physician data query recommends that individuals who have had any of the following findings may benefit from nutrition support. The dietitian or healthcare provider Should be consulted about the need for nutritional support for weight less than 80% of ideal body weight or weight loss of more than 10% of the usual body weight. Intolerance of oral/enteral feedings for more than 5 days. Malabsorption of nutrients due to disease, short bowel syndrome, or anti-cancer therapy. Fistulas or draining abscesses. Moderate or high nutritional risk status as determined by screening or an assessment tool. Assess for fatigue and anxiety in a patient being treated for cancer. A decline in sexual desire is not uncommon during cancer treatment. Assess for anxiety about sexual intercourse, including fears concerning contracting cancer from the patient and fears that sexual intercourse will make the cancer worse. Assess the patient's feelings about any actual or perceived change in appearance due to surgery, radiation, or chemotherapy. Nursing, diagnosis, planning, and implementation. See the nursing care plan for the patient with cancer for top nursing care priorities. Additional nursing diagnoses are presented next. Remember to assess each patient before assuming a nursing diagnosis applies to that patient. Nursing care plan for the patient with cancer. Nursing diagnosis, ineffective coping related to the diagnosis and treatment of cancer as evidenced by behaviors such as denial, isolation, anxiety, and depression. Expected outcomes. The patient will cope effectively as evidenced by identifying stressors related to illness and treatment, communicating needs, concerns, and fears, and use of appropriate resources to support coping. Evaluation of outcomes. Is the patient able to identify stressors and communicate concerns? Does the patient effectively draw on past coping mechanism? Does the patient have and appropriately use support systems? Intervention. Assess effective coping mechanisms used in the past and currently available to the patient. Coping mechanisms that worked in the past may be helpful again. The nurse can support appropriate choices. Is the patient able to identify and draw on past coping mechanisms? The next intervention is to use active listening skills to encourage patient to express feelings and fears. The patient must identify fears to be able to effectively cope with them. Does the patient identify fears and concerns? Assess the meaning of quality of life to the patient. Once identified, the nurse can assist patient to achieve quality of life goals. Is the patient able to identify the meaning of quality of life? Are there ways the nurse can assist the patient to reach quality of life goals? Maybe their goal is to be able to eat a bowl of chocolate ice cream. Assess for suicide risks. A patient who feels hopeless may be at risk for suicide. Is patient at risk? Are suicide precautions necessary? Explore outlets that promote feelings of personal achievement. Personal achievement promotes self-esteem. Does the patient have creative outlets that promote feelings of achievement? Can the nurse assist in implementing these activities? Consider the use of humor. Humor can be both distracting and therapeutic. Does the patient use humor? Does it provide temporary distraction from concerns? Nursing diagnosis, acute pain or chronic pain related to tissue injury from disease process and treatment. Expected outcomes. Pain will be prevented and the patient will be comfortable at all times as evidenced by the patient stating pain is at an acceptable level on the pain scale. Evaluation of outcomes. Does the patient state pain is controlled? Intervention. Assess the patient's pain based on what's up mnemonic. Assess Assessment provides direction for the treatment plan. Is the assessment complete and used to guide treatment? Ask the patient to rate pain on a scale of 0 to 10, with 0 being the absence of pain and 10 being the worst possible pain. A pain rating should guide treatment and evaluate the effectiveness of treatment. Does the patient use the pain assessment scale effectively? Is the patient in pain? Administer analgesics as ordered around the clock. Using an around the clock schedule prevents pain from becoming severe. Is the patient's pain kept under control at all times? Check pain relief within 1 hour of administration of medication and then every 2 to 4 hours. Alternative short-acting medications may be necessary for breakthrough pain. Is breakthrough pain present? Does long-acting analgesic need to be increased to prevent pain? Educate patient on the use of patient-controlled analgesia, PCA. PCA allows patient to be in control of own pain relief. Does PCA keep patient pain-free and able to participate in desired activities? Monitor level of sedation and respiratory status if opioid dose is increased. Patients who receive long-term opioid therapy develop a tolerance to the depressant and the depressant effects of opioids. Is the patient alert with a respiratory rate between 12 and 20? Explain the use of non-pharmacological interventions, such as relaxation, once the pain is controlled with medications. Non-pharmacological interventions supplement but do not replace analgesics. Does patient use non-pharmacological interventions? Do they help? Nursing diagnosis, risk for infection related to diminished immunity and bone marrow suppression as a result of chemotherapy or radiation. Expected outcomes. The patient will be free and safe from infection as evidenced by being afebrile and stating self-care measures to protect from infection. So afebrile means without a fever. Signs and symptoms of infection are identified and treated early. Evaluation of outcomes. Are signs and symptoms of infection absent? If they are present, are they reported quickly? Can the patient identify self-care measures for preventing infection? Intervention. Promote good hand washing technique before interaction with the patient. Appropriate hand hygiene can reduce the transmission of antimicrobial organisms or microbial organisms. Are you careful with your hand washing? Have you also instructed the patient, family, and nursing assistants about careful hand washing? Monitor body temperature every 4 hours. Elevated body temperature is an early sign of infection. Is the body temperature within normal limits? Monitor the white blood cell count daily. For the neutropenic patient, the WBC count will not be elevated. Neutropenia is a risk factor for infection. Is the white blood cell count 5,000 to 10,000 per cubic millimeter? Assess for signs of inflammation or drainage at potential infection sites, such as old aspiration sites, venipuncture sites, oral and rectal mucosa, perineal area, axillae, which is under your armpits, under your arms, incisions, pierced earlobes, under breasts, and between toes. Intact skin is the first line of defense against invading microorganisms. Are there any sites that need special care to maintain skin integrity? Watch for signs of respiratory infection such as sore throat, cough, shortness of breath, and sputum production. Hospital-acquired pneumonia has high morbidity and mortality rates. Are signs of respiratory infection present? Assess for signs of urinary tract infection, UTI, including burning, pain, urgency, and blood in urine. Genitourinary tract is the most common site for hospital-acquired infection. Are signs of UTI present? Teach administration of GCSF, granulocyte colony stimulating factor, and GM-CSF, granulocyte macrophage colony stimulating factor, as ordered. These medications help the body produce more white blood cells. Patient may need to administer it subcutaneously at home. Does the patient or caregiver demonstrate correct administration? Is the WBC count improving? Limit visitors only to healthy adults. Viral infection in an immunosuppressed patient has a high mortality rate. Are patient and family aware of visiting restrictions and rationale? Is there a sign on the door reminding visitors? Teach patient to ask healthcare provider about avoiding unwashed fruits and vegetables. Unwashed fruits and vegetables can carry pathogens. Are patient and family aware of the risks of eating unwashed fruits and vegetables? Keep fresh flowers, and potted plants out of the patient's room. Aspergillus is a fungus found in soil and water and can cause pneumonia. Is the room free of potential sources of infection? Evidence-based practice. What educational measures are effective for cancer pain management? Evidence. A review of 34 randomized controlled trials and 8 systematic reviews revealed that educational interventions targeted at people with cancer can improve their knowledge about cancer pain, as well as help them manage pain more effectively. When patients are knowledgeable about the origin of their pain, how to accurately report pain, how medications work, types of interventions, and how healthcare professionals evaluate the need for pharmacological interventions, patients can be more instrumental in managing effective pain relief. Implications for nursing practice. It is important to focus on several areas when talking to patients about their pain, including how to report pain, pharmacological and non-pharmacological pain management strategies, and reassessment of pain after intervention. Ineffective protection related to thrombocytopenia associated with chemotherapy and radiation. Expected outcome. The patient will be free from bleeding as evidenced by stable blood counts and the absence of bruising, petechiae, or frank bleeding. Monitor platelet counts. A platelet count of less than 50,000 indicates potential for bleeding. Teach self-administration of oprelvacin or Numega as ordered. Oprelvacin stimulates the production of platelets. Test all urine and stool for occult blood to detect the presence of blood. Avoid giving intramuscular, subcutaneous, or rectal medications. Medications given via invasive routes can cause bleeding. Apply pressure for at least 5 minutes to venipuncture or injection sites. Pressure for a longer time is needed at the sites of invasive procedures to stop bleeding. Teach the patient about gentle mouth care, including no flossing, a soft toothbrush, and wearing properly fitted dentures to help prevent trauma and bleeding. Avoid trauma to rectal tissue by avoiding rectal temperatures and enemas. Teach importance of avoiding anal intercourse. Trauma to rectal tissue can cause bleeding. Instruct the patient not to take any salicylates or nonsteroidal anti-inflammatory drugs because they can interfere with platelet function and cause bleeding in the GI tract. Observe for bruising, petechiae, bleeding gums, tarry stools, and black or coffee ground appearing emesis, which is vomit. These are signs of bleeding. Advise the patient to use an electric razor to decrease the risk for trauma and bleeding. Teach the patient to avoid forcefully blowing his or her nose or inserting objects into the nose to reduce trauma to nasal mucosa to prevent spontaneous bleeding. Teach the patient to monitor for bleeding with intercourse because of the risk of trauma to tissues. Imbalanced nutrition, less than body requirements related to anorexia, nausea, or vomiting associated with disease, pain, and treatment. The patient will have caloric intake that is adequate to meet body requirements and balanced intake and output as evidenced by stable weight. Monitor food and fluids intake and output every 8 hours. This will provide objective data for the amount of nutrients and fluids taken in. Weigh the patient daily. Weight is an objective measurement to determine if intake is adequate enough to maintain weight. Consult a dietitian for dietary supplements. Dietitians can calculate the calories needed for adequate nutrition and make recommendations for supplements. Consult with the HCP for medications to control nausea, vomiting, and diarrhea. If these symptoms are controlled, then the patient is better able to eat. Keep the environment free of strong odors such as disinfectants, perfumes, deodorizers, and body wastes. Strong odors can induce nausea. Provide room temperature or cold foods and clear liquids. These foods have fewer odors and may be more comfortable for the patient to eat. Offer sour foods such as hard candy and lemon. These can help control nausea. Provide mouth care before meals. Oral care allows for a better taste in the mouth, and saliva is needed for digestion of food. Provide small, high-calorie meals. Eating smaller, more frequent meals prevents the patient from feeling full and nauseated. Administer pain medication before meals to help reduce the impact of pain on appetite. Instruct the patient to avoid fluids with meals to prevent premature feelings of fullness. Teach the patient to avoid exercise before meals. If the patient is fatigued, he or she will not have the energy to eat and digest food. Nutrition notes. Treating problems related to nutrition. Early satiety and anorexia. Present meals in a calm, comfortable environment, offering assistance as necessary. Provide small, frequent, every 2 hours meals and snacks that are high in protein and calories. Arrange for assistance in preparing meals when at home. Dispense liquid supplements as recommended by a dietitian. Encourage regular exercise, which may promote appetite. Changes in taste and smell. Provide oral hygiene before meals. Cook in glass containers in a microwave. Use plastic utensils for eating for metallic taste in mouth. Serve food cold or at room temperature. Offer lemon-flavored candy and beverages or gums and mints. Provide fish, eggs, poultry, and dairy products instead of beef and pork. Promote foods with sauces and seasonings. Sweet sauces and marinades may improve the palatability of meats. Offer high-protein vegetarian meals if meats are not tolerated. Local oral effects. Ulcerations. Offer soft, mild foods, cream sauces, gravies, and dressings for lubrication. Cold foods such as non-citrus popsicles for numbing and straws for liquids. Avoid hot items, salty or spicy foods, and acidic juices. If an anesthetic mouthwash is prescribed, the mouth may be numb. Caution the patient to chew carefully to avoid biting the lips, tongue, or cheeks. Dry mouth. Offer frequent sips of water or artificial saliva. Lubricate with gravies, butter, margarine, milk, cream, or bouillon. Sugarless hard candy, chewing gum, or popsicles may stimulate saliva production. Perform oral hygiene at least after each meal and before bedtime. Dysphagia. Have a speech pathologist evaluate the patient to determine the appropriate diet order in consultation with a dietitian and position for eating. Liquids may be modified in viscosity to enable the patient to safely swallow and reduce the risk for aspiration. Nausea and vomiting. Administer antiemetics on a regular prophylactic schedule. Rinse the mouth before and after eating. Offer lemon or mint hard candies. Suggest dry crackers. Provide bland foods, avoiding spicy and greasy foods. Offer liquids between instead of with meals to reduce stomach volume. Offer low-fat meals to improve stomach emptying. Remove covers from food containers from the bedside if strong odors disturb the patient's appetite. Instruct the patient to chew thoroughly, eat slowly, and rest afterward, either sitting upright or reclining with the head raised for 1 hour after eating. Arrange meal schedule to take advantage of times when the patient feels better. Avoid serving favorite foods when the patient is nauseous to avoid an association between these foods and vomiting. Diarrhea. Suggest a low fiber diet. It should be individualized per patient's tolerance. Provide fluids which may be tolerated better at room temperature. Limit the consumption of sugar substitutes, sugar alcohols in beverages, candies, and gums. These may promote diarrhea. Limit milk to 2 cups per day or try a lactose-free diet for temporary lactose intolerance. Propose pectin-containing foods, apples, strawberries, citrus fruits to absorb water in the bowel. Ask the healthcare provider or dietitian about probiotic therapy to help repopulate the intestine. Consult with a dietitian about special feedings. Altered immune response. Observe strict procedures for food safety and sanitation to avoid exposure in foods. Keep foods within safe temperatures. Cold under 40 Fahrenheit, hot over 140 Fahrenheit. Do not eat foods outside their expiration dates and avoid undercooked and raw meats and eggs. Provide individually packaged foods, avoiding leftovers. Avoid salad bars and buffets when eating out, and wash fruits and vegetables before eating. Social isolation related to changing relationships. Expected outcome. The patient will manage social isolation as evidenced by the ability to identify feelings of isolation and 2, the ability to participate in chosen activities. Observe the patient for signs of barriers to social interaction, such as incontinence, lack of transportation, or inadequate money or support system. Why a patient feels isolated can vary from one person to another, but knowing the reason can help the nurse plan appropriate interventions. Discuss causes of perceived or actual isolation. How the patient is dealing with the illness will have an impact on how he or she manages the illness. Promote opportunities for the patient to interact socially, such as at meal times or during therapy sessions. The patient will feel less isolated if given an opportunity to participate in diversional activities. Provide information about support groups and encourage the patient to contact them. Support groups can help the patient cope better with stressful events in life. Disturbed body image related to cancer and its treatments. Surgical procedures such as mastectomy, osteotomy, or loss of hair from chemotherapy. Expected outcome. The patient will be able to accept changes in the body image as evidenced by willingness to participate in care and adjust to changes in lifestyle. Allow the patient to discuss feelings of anger or depression and confirm that these feelings are normal when adjusting to body changes. A patient may be better able to cope with body changes if he or she can talk about feelings and understand that they are normal. Encourage the patient to select a wig before hair loss so the patient can find one resembling his or her own hair color and style. Provide education and urge the patient to care for the osteotomy site or surgical wound when ready to promote independence. Provide information about resources such as Reach to Recovery and Look Good, Feel Better support groups. Support groups provide a forum for patients to share their experiences with others undergoing similar changes. Provide information about community assistance and financial aid for programs or services. Social workers can help with community resources that can provide equipment and supplies for the patient. Additional nursing diagnoses that might be appropriate include self-care deficit related to weakness and fatigue, ineffective sexuality pattern related to change in body functions, and grieving related to diagnosis and potential disease outcome. Grieving and end-of-life care are covered in depth in Chapter 17. Caregiver role strain related to needs of patient and anticipated outcome. Expected outcome, the caregiver will be prepared to provide care effectively as evidenced by 1. Identification of resources available to assist in providing care for the patient, and 2. Maintenance of the caregiver's physical and emotional health. Observe the caregiver's ability to provide care for the patient. The nurse needs to know if the caregiver will be able to handle the care needs. Observe the quality of the relationship between the patient and caregiver. The quality of the relationship impacts the care delivered. Actively listen to the caregiver's concerns. Doing so can assist the nurse in assessing the caregiver's ability to cope and can help in planning care. Teach appropriate caregiving skills as needed. The caregiver may not be aware of how to bathe the patient or how to provide basic or advanced care. Assist the caregiver to identify available supports. Assistance can provide a break and decrease the risk of exhaustion and depression in the caregiver. Instruct the caregiver and the resources available in the community. Support groups can help the caregiver by providing an outlet for sharing concerns and finding support. Consult the multidisciplinary team to provide the services needed at the time of discharge. Preparing the caregiver for the discharge needs/care with the proper resources will help the caregiver feel empowered to deliver care. Watch for signs of depression in the caregiver and intervene to help coping. The caregiver can develop a weakened immune system secondary to stress and depression. Arrange for respite for the caregiver or encourage the caregiver to utilize this service. Respite care can provide a break for the caregiver. Assist the caregiver with ways to decrease stress. Encouraging caregivers to take time to care for themselves will leave them with the energy they need to continue providing care. Evaluation. If the interventions have been effective, the patient will have no unusual bleeding or bruising. The patient and family will be knowledgeable about risk factors for bleeding and about signs of bleeding to report promptly. The patient will be nourished and maintain weight within normal limits. Caregivers will know how to provide care for the patient. They will make use of resources in the community to assist with patient care. The patient will be able to discuss feelings of isolation and seek out activities to safely participate in. Finally, the patient will adjust to changes in lifestyle and body image. The patient will be able to openly discuss concerns regarding body changes and be able to maintain control of his or her own body. The patient will know about community resources and support groups to assist with the needs related to body image. So before we start this critical thinking, we're going to watch this YouTube video.
I was surprised because in the condition that she's in, a person like that, usually they really don't want to interact with nobody. You know, like you're at the end of life.
Takes a little while.
Can somebody help me fix my blankets?
I'm gonna do all this. I'm gonna fix this up. You want this one? This one? This one has roses.
She was very clear. She was teaching about pancreatic cancer, death and dying, and pain.
We started doing research and looking up her disease and stuff like that and asking her questions. She was very talkative. I was happy that she was able to open her house and her life and her disease for us to learn about it.
It's like a cycle, your life. You started going to school in Holyoke, and now you're teaching for Holyoke.
Yeah.
And all these people in your class and all the teachers that knew you, now they know you again.
As a teacher.
Pretty cool.
I know, this is so blowing my mind.
It's blowing your mind.
Yeah.
I think she actually wanted someone to talk about it with her.
I have 6 months to live, and I already passed that by.
A couple months. That's
Yeah.
when you went to hospice, right?
Yeah. This is the second time that I've been in hospice.
Your heart just hurts. It's like, what can we do? And that helplessness is very hard.
Pain.
In school, they always teach us, like, pain management is the biggest thing. Like, you know, we have to treat the pain. With her, like, how do you treat it? Like, you tried everything. What else is there to try, you know?
Mother and child, holy infant, so tender and mild, sleep in heavenly peace, sleep in heavenly peace.
Mrs. Jones is admitted to your unit after a simple mastectomy for breast cancer. The tumor was staged as a T2 NOMO. A bone scan was negative for metastasis. She is scheduled for 4 chemotherapy treatments, 3 weeks apart. The medications prescribed are high doses of doxorubicin, which is also called adriamycin, and cyclophosphamide, also called Cytoxan. A central line is inserted for chemotherapy. What does the staging of Mrs. Jones's tumor mean? And on page 168 of the book are the suggested answers to critical thinking, which state, Mrs. Jones's tumor is beginning to invade surrounding tissue. There is no lymph node involvement and no metastasis. Number 2, what major side effects of her medications should you look for? Well, doxorubicin, also called adriamycin, is commonly associated with red urine. It also poses a risk for cardiac toxicity. Cyclophosphamide cytoxin can cause blood in the urine and a risk for hemorrhagic cystitis. Therefore, the patient should take plenty of fluids and void often, every 2 hours. Both medications can cause nausea, vomiting, and alopecia. Both are vesicants. Number 3, why was a central line inserted? Because the drugs are vesicants, it is important to inject them into a large vein. Number 4, what nursing diagnoses are appropriate for Mrs. Jones? Many diagnoses are appropriate, including acute pain related to surgical incision, disturbed body image related to alopecia and loss of a breast, imbalanced nutrition, less than body requirements related to nausea and vomiting, risk for injury related to medication side effects, and deficient knowledge about cancer treatment and management of side effects. A thorough nursing assessment is needed to determine actual diagnoses. Survivorship. Millions of people around the world are no longer dying from cancer. Many are either disease-free or continuing treatments to reduce risk of recurrence or to treat a chronic form of cancer. The need for medical and psychosocial interventions is ongoing as cancer survivors and their caregivers continue to deal with the emotional and physical effects of their disease and treatments. Continued reassessment of the patient's needs and creation of a survivorship plan are essential to maintaining a positive outcome. You can help your patients and families find local survivorship programs for needed assistance and counseling. Hospice care of the patient with cancer. Hospice care is considered the model for quality, compassionate care for patients and families facing a life-limiting illness. Hospice provides expert medical care, pain management, and emotional and spiritual support based on the patient and family's needs and wishes. National Hospice and Palliative Care Organization, 2017. Patients who have a life expectancy of 6 months or less are eligible for hospice care. The hospice approach includes an interdisciplinary team working together to develop a plan of care meeting the patient's individual needs for management of pain and symptoms. Hospice care is offered as an inpatient or outpatient service. It may also be provided in nursing homes and assisted living facilities. Home health hints. The home health care or hospice nurse helps manage cancer pain in the home. Oral, transdermal, or intravenous analgesics are preferred. For moderate to severe pain, doses should be given around the clock with as-needed doses for breakthrough pain. The nurse is in contact with the interdisciplinary team to update plan of care as necessary. The nurse should anticipate constipation from opioid administration and treat prophylactically. Some patients are fearful of taking prescribed pain medications. Explain the importance of taking the medications as ordered. Explain that it is easier to maintain pain relief than to reverse severe pain. Home health care nurses are in key positions for making timely referrals for hospice care. Eligible patients are those who have a life expectancy of 6 months or less and who have a desire for supportive palliative care rather than continued treatments. Inpatient services are used for symptom control and respite care for the family. Family and pets may be allowed to stay with the patient. Hospice care assists the family in crisis and continues for up to 1 year after the patient dies with follow-up counseling, listening, nurturing, and referrals. Hospice care is given in the home with hospice staff educating family members in the care of the patient. Hospice staff also offers supportive care and pain management, psychosocial issues, bereavement, and symptom control, as well as assistance during crisis. Hospice benefits are provided regardless of the ability to pay. They are covered by Medicare, Medicaid, and other insurances. In the home setting, a patient can maintain normal life patterns with familiar surroundings for as long as possible. Oncological emergencies. This is on page 167 of the 6th edition. Superior vena cava syndrome. Superior vena cava syndrome, SVCS, occurs in patients with lung cancer or cancers of the mediastinum when the tumor or enlarged lymph nodes block circulation in the superior vena cava. This results in edema of the head, neck, and arms. Symptoms include shortness of breath, cough, chest pain, facial redness, and swollen neck veins. Radiation therapy can be used to shrink the tumor and allow circulation to resume naturally. Nursing interventions for the patient with SBCS include removing rings and restrictive clothing, avoiding taking blood pressures and venipunctures in the arms, and elevating the head of the bed to decrease feelings of dyspnea or difficulty breathing. Spinal cord compression. Spinal cord compression occurs when a malignant growth presses on the spinal cord. This is a painful problem and requires pain management while the radiation is given to relieve the symptoms. Patients may develop some motor loss when this occurs. A myelogram or bone scan may be used for diagnosis. Nursing care includes providing a safe environment, assisting with activity, and watching for changes in neurologic status, as well as changes in the location or intensity of pain. Patients at risk include those with cancers that spread to the bone and spinal cord, such as lung, breast, and prostate cancer. Hypercalcemia. In hypercalcemia, the blood calcium level exceeds 11 milligrams per deciliter. Hypercalcemia can result from the release of calcium into the blood from bone deterioration or from ectopic secretion of parathyroid hormone by a tumor. It is common in patients with bone metastasis, especially metastasis from breast cancer. It can be treated with IV medication and hydration to lower the calcium level. Nursing care includes maintaining safety and monitoring intake and output, pain control, and changes in pulse rate and rhythm. Which test is essential to the diagnosis of cancer? Is it 1, biopsy, 2, laboratory tests, 3, cytological study, or 4, MRI? And the answer is biopsy. If you want to know absolutely for sure, you need to grab the tissue from where the cancer or tumor is. What does MX stand for in the TNM staging system? Is it distant, metastasis, proximal metastasis, no metastasis, 3, no metastasis, or 4, unable to evaluate metastasis. And the answer is 4, unable to evaluate. Review question. Which principles are essential for maintaining safety when working with patients with radioactive implants? Is it caring, time, distance, communication, or 5, shielding? The answer is time, distance, and shielding. And that is to protect yourself as a nurse. You must be very cognizant of those 3 things. Which interventions are appropriate for a patient with thrombocytopenia, which means low platelets? Well, number 1, limit visitors. 2, protect from injury. 3, report bruising or bleeding. 4, avoid fresh, unpeeled fruits or vegetables. And 5, administer oxygen as ordered. The answer is 2, protect from injury, and 3, report bruising or bleeding. Which patient is appropriate for hospice care? Is it 1, a patient with kidney disease who has just 3 months to live, or a patient with cancer who is receiving chemotherapy? 3, a patient trying an experimental therapy for lung cancer, or 4, a patient with complications of diabetes? The answer is 1, a patient with kidney disease who has 3 months to live. Okay, this chapter also directed us to take a look at Appendix A. And so that's where I am at right now on the screen, and it's covering diagnostic tests. It says this is intended to be a quick reference only. Please check a diagnostic test reference manual for comprehensive information. So then there's some general considerations for all the tests, which is ensure that an informed consent form is signed before any invasive procedure, and check orders for the need to withhold food or fluids before the test. Preparation if contrast media will be used to prevent reaction or nephrotoxicity. 1, check for and report allergies to iodine or contrast media. 2, report low glomerular filtration rate, GFR, or elevated creatinine/blood urea nitrogen bun levels, because contrast media is nephrotoxic and excreted by the kidneys. 3, consider patient risk factors for contrast-induced nephropathy, which renal disease, diabetes, hypertension, chemotherapy, and discuss with the HCP prophylaxis orders, such as providing intravenous hydration or prophylactic pre-medication, such as acetylcysteine, which is Mucomyst. 4, if the patient is taking metformin, hold it as ordered before the test, typically 1 or 2 days, and then for 48 hours as ordered after the test until the renal function is determined to be normal to reduce the risk for lactic acidosis if acute renal failure develops due to the contrast media. 5, teach that the patient may experience a feeling of warmth or experience a salty or metallic taste when the contrast media is injected. Encourage increased fluids after test to promote excretion of contrast media, and reinforce patient education for the test. So this appendix is wonderful because it goes through so many of these. It's fantastic. Angiography, biopsy, CT scan. It kind of explains, describes it, why you would do it, what some of the nursing considerations would be before you conduct the test or procedure, as well as post-procedure nursing considerations. And there's ECG, EKG, there's EEG, endoscopy, bronchoscopy. There's just so many. I just thought it would be valuable to go through. I'm not sure why I can't get everything on the page here, but bronchoscopy, colonoscopy, colposcopy, gastroscopy, sigmoidoscopy. There's a lumbar puncture. There's MRI, myelography. There's nuclear scan, which is done on the heart, lungs, CNS, thyroid, bone, or other. Of course, radiograph, which is X-ray, and ultrasonography, endoscopic ultrasound, as well as transesophageal echocardiogram and transrectal ultrasound, as well as transvaginal ultrasound, which many people are familiar with. So I also wanted to show you Appendix B, which was also mentioned, and this is a great resource just to review what the normal adult reference common lab values are. So these are a lot of the common tests that are run, and then what values would be considered normal, and it's listed for conventional as well as SI, which would be international units, and if there's a conversion. So it speaks about the urinalysis references for what could be expected as far as the pH and some of the other tests. There's also a lot of blood values, including bleeding time, prothrombin time, hematocrit, platelet count, RBC, all of these. There's also including these therapeutic drug levels. So if your patient is being treated with lithium or digoxin, we will be periodically checking their blood levels to make sure that they're staying within the expected range. And then there's also the CEA and some other immunological tests listed. So looks like a wonderful resource, and I'm sure we can look more at it later. Thank you so much for joining.